Great. Well, I think, Malcolm, your comment about Continuum is a good segue into the next section. And, and this is where we get you all to help us. So we have 5 questions here to consider. And the first is, what are the challenges in engaging the entire continuum of learners' organizations in the accreditation process? Okay. And then, how do we align the requirements of accreditation standards with educational programs or vice versa? Third is, how do we prove the worth, whether that's in validity, evidence, inferences supported, of accreditation in protecting the health of the public? What is the future of education and accreditation balance across the world? That's very general. And then last, how do we best partner with patients, populations, communities, and governments in promoting the role of accreditation, ensuring quality education and training? So some a little more focused, some a little more broad. Let's just take them. Whoops, are you advancing my slides as well? So first is, what are the challenges in engaging the entire continuum of learners, organizations in the accreditation process? And we've already started to scratch the surface of this, but let's hear your thoughts. I'm going to need something to go back to the big group with, so you got to help me out. Please.
I think something that's fundamental to all of these questions is I'm curious about people's, in this room, how you think about your capacity to have influence versus control. And I've been looking lately at the difference between simple, complicated, and complex problems. And in part of my background is in computer programming, and that's where that division of problems comes from. And in that world, anytime a human being is involved, they call it a complex problem because you have no control. You know, whereas with ones and zeros, you have lots of control. And now in the world of accreditation, as much as the people that I work with at times talk as if we have control, that if they're accredited, we control them. No, we don't. All we have is influence. They're human beings. And so the question that was asked in the last session about buy-in, how do you create buy-in? I really wonder from this group, how much time are people spending thinking about buy-in versus disciplinary action or requirements or whatever, just to look at those two things.
Thank you. Another comment from table 2.
I think one of the challenges is going to be getting the accrediting bodies as a whole to agree to something, and that's just the educational accrediting bodies. And then when you throw in the practice side and their accreditation, I think the challenge is, you know, why are they telling me what to do on both ends? You know, again, going back to what was set up here, there's got to be a little give and take on both sides to accomplish anything. I think that's going to be the biggest challenge.
Okay. Yes.
Mark Merrick from Athletic Training again. One thing that strikes me, thinking back to Susan's model this morning of the arrow and the oval, and I think a lot of this discussion centers around where on the arrow is your oval? If we're pretty far to the left, looking at only well-established practices and really setting a floor, then that's very different than if an accreditor sees their role as fostering innovation. And I think that when we're setting floors, we're not terribly interested in negotiating how far down we'll go on that floor. Mm-hmm. But on the innovation side, I think we've got a little more room to maneuver. And I think that part of this conversation is getting the different accreditors to talk about philosophically where are they in their role as an accreditor. Because until we kind of know where we are, it's hard to talk to somebody else about how we interact with them.
And just to clarify, you're talking about other various accreditors being within the same discipline, but in various stages of
Sure,
practice.
or even educational versus practice accreditors.
Okay.
You know, if I, as an educational accreditor, I'm thinking of myself as trying to push innovation and bring a profession along into a more mainstream position within healthcare, that's a little different kind of view than if I'm working with a practice accreditor who's looking at setting a bare bones floor on this is the minimum set of standards you have to have in order to have a competent practice facility. In one, I'm trying to expand boundaries, and in the other, I'm simply trying to make sure that you don't fall beneath them.
Mm-hmm. Yes.
Are there other carrots out there to make this happen? Just things that are to everyone's advantage, so if you work together, you have a better outcome.
So, other incentives to actually work together and work across those boundaries? That's a great question. Someone else might be able to answer that.
I just wanted to comment on that. So if you are in a big academic health center with multiple kinds of training programs, you might have 40 accreditations to manage across both the practice and education sides. And that's a huge burden. So I think one incentive is actually to decrease the accreditation burden on systems like that. And the question is, are there surrogates that one side of the other side of accreditors can deem met? Like if you have a wonderful care environment that produces wonderful care, can we deem some of the education standards to have been met? I mean, is there some deeming reciprocality of standards in, let's say, just wonderful environments that people are willing to give up? That, okay, I've said that's okay. So I don't know, because again, it's control, isn't it? It's like, would an education accreditor ever say, oh, you're doing such great patient care, I don't even need to come see your program? Would they?
Malcolm, did you have a comment?
Can I just have a follow-on to that, because it's directly related to that? So the veterinarians, I think, may be one of the few groups here that actually do international accreditation. So it's AVMA, Council on Education in this country and Canada, but AVMA also accredits in other countries who have other accrediting institutions. And the process you just described started about 18 years ago with them of, okay, we're not giving up anything, you're not giving up anything. And it just evolved over time, and now we're using a harmonized rubric. People have just sort of horse traded around it, and it actually worked. And now you have these multinational site teams that have 4 accreditors. The school gets to do it once, and they check all their boxes, and it's actually gratifying.
Yes.
I was going to simply say that to some extent, we're starting to see some of that now. In my field in athletic training, our traditional area of practice is in intercollegiate and interscholastic athletics. And those facilities never had a practice accreditor. So as I mentioned before, we had a number of accreditation standards in our educational standards about quality of those facilities and things they had to have in place. But now that we're seeing athletic training practice expand into other areas, we're already doing things like, oh, your facility is JCO accredited? All these standards, don't worry about it, you're covered. So we are starting to see some of that in some places now.
So one of the things I used to do in my last job was I used to work with governments to help them draft legislation in relation to the regulation of nurses. And one of the most interesting discussions I always had was with the Attorney General to try and persuade that person that using the word can is much better than should, is much better than must. Because if you start to have everything as a must, it really fixes you in a point of time. So if we could start to draft standards in a way that gives us some flexibility, it then enables people to work together. And again, an example from Scotland, when I was the chief executive of the regulatory body that accredited educational programs, nurse educational programs in Scotland, our legislation enabled us to either carry out or have the evaluation conducted by a reputable body. I spoke to the Quality Assurance Agency for Scotland, which was the higher education agency, and said, how do you go about doing your accreditation? Can I distill from your data set all the information I need? Is there any gaps? Here are the gaps that we've been able to identify. Can we agree to either add that to your list, or we'll just simply do that? And by looking to see how we can actually jointly reduce our overhead costs in this process, it's amazing how quickly you start to work together to demonstrate that actually there's something in it for both of us. So I think, you know, if we can be very pragmatic about the way that we write some of these things down that don't fix us in a point of time, and give people that space to negotiate, and then to benefit from that collaboration, then I think that's where some of the carrots might come from, rather than, you know, the stick, which doesn't really work that well.
Other comments? Oh, as a good example of an incentive there, any other ideas? What would your accreditors need? What are some examples of things that would be meaningful incentives to work together across boundaries? Any ideas? I have a question in the back. Yeah.
I always go back to money. Well, just follow the money. I think if there were financial incentives to work together, we wouldn't even be having this conversation. So, personally, in my own world, I'm going to take that as a business challenge or a problem to solve. I like those kind of problems. So I'll let you know if I come up with anything.
Thank you. Do you have another one, Elizabeth?
That was exactly the point I was going to bring up as well, in saying, in addressing the question, what are challenges? It's quite significant financially, burdensome, and resource heavy. In an ideal world, I like the idea of the additional layers, the continuum being a collaborative and synergistic approach. But unfortunately, at our current stage of development, in my experience, it's more layers. It's separate layers. It's not synergistic. It's not collaborative. And that does induce a pretty significant financial burden about it. But I really also wanted to come back to the first point as well, of saying influence versus control. And as a college, we've taken the approach to be a resource for our licensure, examination, state, national, et cetera. But we really don't seem to have much influence. We can be a resource, but can't do much more in terms of participation. And there are a lot of reasons why that happens, and some of them are just sheer logistics. So, for example, what would be my sphere of influence? If I were responsible for continuing the relationship with my alumni, they're across the country and international. If I take instead the approach of my state, I've got all kinds of mixed educational experiences. So where is my focus, and what opportunities do I have to support it logistically? So it gets pretty daunting pretty quickly in those types of environments. So a lot of challenges, I think.
To bring another example from the animal kingdom, if you do research with animals in universities and you have federal dollars, then you have to have certain requirements that you meet. And some of those can be met by a voluntary certification by an external body called ALAC. So if you're ALAC accredited, you check a whole bunch of boxes on the animal welfare, animal care front. So universities can choose to do that. They don't have to do that. But if they do it, they save themselves time and money. So it almost feels like you're never going to get everyone to buy in, but if you could get a group of peers to say, we're going to develop a system that we're going to design, and we will buy into that system and be able to claim that we've now done this greater amount of work. And look, it's a seal of approval, which, again, if it's valuable, people will start to say, you know, that's a pretty good idea. I think I'll do that too. I don't know. I'm not quite sure that maybe apples and oranges, but it works really well on that other front.
Thank you. Malcolm?
So apart from leadership, which is important, money is the next set of issues that are important. And if we could show by appropriate econometric analyses that working together, bringing Karen circles together, or David said the same thing, okay? We could show that saved money, was more efficient. That would be an enormous facilitator of a incremental approach to integration as opposed to doing everything separately. We tend to have this fly apart mentality, not only shown in our desire to make specialties and subspecialties and subspecialties, but associations, sub-associations, etc. And there have to be, I would think, if the right economists got involved in thinking about this, there has to be ways of showing it's going to save money. If you can show it will save money, then you get the attention of your legislative bodies or your ministries of health or education. Short of that, or short of outstanding leadership to sort of, lead the charge, I don't see how you're going to get the kind of change that's necessary to do this.
Yes.
On the same theme of money, and I actually don't know the answer to this question, but do accreditation bodies actually make money on doing accreditations?
I can tell you that some do.
I mean, is it,
Without
because aren't they
naming
sort of
it.
tied to their own professions in other ways, sort of?
It's their incentive.
Right? I mean, just, what I'm saying is as a burden, they're gonna have to agree to give up that revenue. Or else there'll have to be a way to do shared revenue.
Before we move on to the next question, David or Karen, do you have any other comments?
Well, I do want to come back to this point that Elizabeth kind of raised in terms of, there are many things we can do here, but what's the best solution? And, I think one of the things that we don't do particularly well is, and it links to the point that Malcolm made about leadership, is that there is a skill set around influence which we tend not to teach. We kind of tend to find it out as we go along rather than actually teach it. And, I think that's one of the things that we actually need to have is a much wider tool set in terms of how you bring about influence. I learned when I was at ICN that, if I want to change UN level legislation, I need to know exactly how the system works, who the key players are, and the price that I have to pay is that I never speak about the pieces of legislation that I actually drafted, because it's the minister from Norway or whoever it is that actually stands out and takes the plaudits for that. So I do actually think that point that you make, Malcolm, about leadership and the skill set to bring about some of these changes is something that we also need to consider as part of this strategy.
Great. Let's move on to question 2 in the interest of time. So how do we align the requirements of accreditation standards with the educational programs, or vice versa? Start from scratch, okay? Blow it up and start over, okay?
I say that because we were just in a previous one and we were talking about accreditation standards, and even across, and I only know the education side, with the other side, but they're all different. They're not leveled the same. Some are built off of standards, some are built off of competencies. You'd have to come together and do consensus on global things and then narrow down. But you really have to start from the beginning.
How easy?
An informed beginning.
Right. So how easy is it to get consensus if you were to do that?
I actually have looked at them across a lot. Conceptually, they have a lot of the same content and material. It is just framed differently. It has different depth. It has different emphasis. It's you know, some things stand alone because they're just very important for that profession, where in others it's a piece of it. The difference between pharmacy really emphasizing pharma therapeutics versus it being a part of advanced practice education, although it's probably a bad example, but it's different.
So, I mean, I think Mary Beth's got a point here, and you know, sometimes it's not actually about having a single set. You know, there's a wonderful thing called the Rosetta Stone, which enabled you to unlock languages because of the able to calibrate a language that we knew with another language. And I think part of it is maybe about calibrating some of the existing standards to actually say, and I'll talk about this tomorrow when I'm doing my formal presentation, but you know, part of it is actually about if 95% of it is core and it's common, well, actually, let's see if we can start with that bit rather than actually the 5% that we're going to fight over. So, you know, this kind of concept of calibration, the kind of Rosetta Stone of accreditation standards, let's see where we can go with that.
Thank you. Yes.
Yep. I wonder if we could get some clarification on the question. I mean, were you talking about aligning accreditation standards across professions or aligning them one-to-one, for instance, physician's assistant accreditation standards to physician assistant educational programs? I think those are different things.
Well, I think when we wrote this question, we were very specifically vague about it. And I think we can reframe it however we like. Yes, Neil.
Let's try again. Yay. Because, I mean, the question was about aligning education standards with practice. And I think it comes back to, you know, with the move towards outcomes, and if you look at the Joint Commission and the other big accreditors in the clinical environment, it's all about outcomes. It's the quality of the service provided by the facility. And if you look at it historically, most of our education started out in those facilities. They grew their own. They educated their own practitioners. And because they had a shared common goal to provide quality outcomes for their patients or the receivers of those services, even if they are health and wellness, whatever. So I think if we could get back to the fact that we have that common outcome as our goal, because somewhere along the line it got split. And you know, the outcome for an education program became, you know, you completed your degree successfully and you passed an exam. Whereas, you know, now everybody's shifting back to this concept of, well, what's the final outcome? And I think that comes into Malcolm's point about the money. Because in the end, the money is about what's the cost of the overall system to educate and provide healthcare to the system. And how much does that cost us?
Lori Schrader, Commission on Collegiate Nursing Education. I'm sorry, I'm struggling still with the question about aligning the requirements of accreditation standards with educational programs, because I think that people in the room are talking about two different types of accreditation, and it makes a difference. So if you're talking about institutional accreditors like JCO or the regional accrediting bodies that look at institutions of higher learning, that's one thing. But if you're looking at programmatic or specialized accreditors, we are looking at the educational programs, so our standards are aligned with educational programs. So I'm still confused by the question and what we're talking about.
Well, what would be the best way to clarify this and make it a little more streamlined?
If the session is about practice versus education, coming back to the two circles, and I think you could really resolve the confusion by putting that into the question. That is, how do you align the requirements of two different systems of accreditation, those two in particular? If that's the question, then, because I think you're right that it could be anything the way it's written now.
Patricia's giving me sign language that they're not picking up your sound, by the way, Malcolm, just so you know.
Well, I mean, I don't want to talk to the wall. It's sort of hard to, you know what I mean? We need mobile mics, Patricia, or something. But in any event, I think if you define this, and I think this is what Neil was getting at, the intent of this overall session is bringing the practice and education circle together, and mechanisms or the barriers to that. If you defined it in that way, then you wouldn't have this problem, because I think within a particular program, the standards do come from, they are aligned with the educational programs, poorly or well, but, right?
So in that case, if we add the word practice, requirements of practice accreditation standards with educational programs?
How would you align educational and practice accreditation standards? I mean, just so quick and simple.
I'm going to be the dense person in the room. I'm going to be the one that they're like, oh, please just stop talking. We get that you don't understand. You know, I'm thinking about our standards review and revision process, which we undertook a few years ago. We undergo it every 5 years as part of our, minimally as part of our U.S. Department recognition. And you know, as part of that process, you know, we had an appointed standards committee that was representative of faculty, it was representative of deans, it had representatives from practice, as well as we had a public member on the committee. And so as we developed and reviewed and revised our standards, not only did we have a wide range of individuals around the table, but then we put the standards out for public comment on 3 different occasions, and we did our darndest to make sure that we were hitting every possible community of interest, whether it was other schools of nursing, nurses who were in practice, acute care settings, whoever it might be that would be impacted by the education of nurses. So I mean, we believe that's a best practice to get input from all of the possible communities of interest. So I guess I'm still confused about what we're trying to learn or address right now. I'm sorry.
So, I mean, I just remind you what I said earlier. You know, we shouldn't be always beating ourselves on the head. If we've got good things already working, then we should identify and shine a light on those examples. So if there is a system already in play that has a process associated with it, I would actually add another step to that. I would say that in Europe, many of the processes, all the information and comments that people actually submit, they are publicly available, and there is a commentary given by the commission or the accreditor or whoever it is in terms of what they are doing with that comment. So they can say, well, we choose to ignore this because of X, Y, and Z, or this is a really good thing that we haven't thought about, and this is what we're going to do. So there's a level of accountability that's built into the system that, you know, I think we can pick on some of these things and say, well, how would that play within the US context? Or you know, this is a great example. How can we get other people to buy into it? So I think it's about not saying it's all doom and gloom, but actually saying, well, we've got some good things here that we can learn from. How can we make that more widely implemented? I mean, I remember the chief executive officer from IKEA saying, you know, the trouble is that people do not wish, they constantly wish to reinvent wheels. You know, what I do is I steal the best ideas and I implement them with real passion and vigor, because I actually short circuit the design process and I make more money that way. You know, so sometimes it's actually about recognizing some of the good things and just going with it.
Start over here.
So we have a similar process for review of standards that's regular, and the comments get published, but we actually still found that wasn't enough because the practicing community didn't pay much attention to that. And so they started having sessions at national meetings, the big national meetings that were mostly practitioner meetings, and they got quite lively. People started really listening, and I thought that was a nice addition to just here it is in an email.
Yes.
Kathy McGuinn from the American Association of the Colleges of Nursing. I could echo what you said about the accrediting agencies in practice and the accrediting agencies in academia are doing great jobs. You listen to your community of interest. The Joint Commission reviews the Sentinel events and comes up with new national patient safety goals, and all that's going really well. The problem we have is we're graduating students with a set of competencies, and we have them ingrained in these students. And then the students go into the real world and they don't see these competencies or anything similar to them in the real world. So we need our wonderful accrediting agencies and our wonderful education people. You know, it's really an academic practice gap, and then an interprofessional gap, and then all kinds of gaps. But we have to get practice and education to the table and say we're not going to be retaining the best and the brightest if we make them schizophrenic because they're getting educated one way and then they go into practice and it's another way.
The question, other comment over here? No? Okay, well, thank you. Let's move on to the next question. So how do we prove the worth of accreditation in protecting the health of the public?
This is Rosemary Senjum, Commission for the Accreditation of Birth Centers. Recently had a conversation with one of our commissioners who argued against this question. He said, you can't protect the public. Stop saying you can. You have no control. All you can do is influence. And that was only part of my investigation into that query. But I think that that's, if we're brutally honest with each other, that's what's true. And so I think part of what we can look at is what is accreditation if we're not protecting the public? I think it is a credential, and I think it does have value, but the value is not armor. It's not, you're going to have, you know, if you get surgery in this hospital or if you graduate from this college, you will get a job. That's not, it's not that kind of protection. You're not going to not have an accident happen. We can't guarantee that.
Debbie Kochever, Cummings School of Veterinary Medicine. I think the other maybe way to look at that question is to say, if you do the process right, and we were just talking about the process where you enroll your stakeholders, they value what you do, and they, in turn, see the value of getting associates that are well-trained because they feel like they've been part of that process. So it almost is like it's a confidence building across the spectrum. And I guess your comment worries me about the graduate students that get out and find that that doesn't match, because it feels like the process prior to that is what would have to get fixed. Because it feels like if you do that well, your students will in fact be doing the public a favor. And so I don't know, it all seems like it fits together to me.
Let's go to 4 and then 5.
I think I might want to just sort of challenge the assertion in number 1 that we can't protect the public. I'm not sure that we're going to be 100% protecting the public, but I think accreditation goes a long way towards protecting the public, and it's better to start somewhere than not having anything in place at all.
So one of the things we've seen, Mark Merrick from Athletic Training Accreditation, one of the things we've seen over the last year and a half or 2 years as people have talked about reauthorization of the Higher Education Act is that right now accreditation is perceived as not doing its job. You know, the former Secretary of Education described accreditors as the watchdogs who don't bark. And it's because we're not always doing a very good job of holding programs accountable when they are deficient on standards. We continue to pass them along and look for ways to help them improve. And from a public protection standpoint, that makes it very hard for you to demonstrate your worth in protecting the public if you don't have an accountability mechanism built in. So from that perspective, I think it's a little bit tough. It's also tough sometimes to count all the situations that were prevented because you did your job right. You know, it's hard for us to show, you know, we see fewer patient errors than if we didn't have accreditation, because no one's willing to cancel accreditation and see how many patient errors we're going to get without it.
Yeah, Neil from OT. The comment before about, you know, if there's a disconnect between the graduates' competencies when they come out and the practice environment, isn't necessarily the school all the time either. I mean, a lot of times it's what's happening in those particular practice environments. And I think evidence-based practice, even though it's an old term now, when we first brought that out, the academic programs were producing graduates who went to look for the evidence to drive their practice, but they found practitioners in the community in those facilities who weren't. So there was a disconnect. And I think the great advantage was if we had sync between our educational accreditors and our practice accreditors about those common outcomes and goals, then we would see a lot more of a connect between, because in some ways I think education helps drives change in practice, and practice helps inform what we need to do in education. So it would be a back and forth, but if they were on the same table, it would be really good. And it goes back to Malcolm's comment before. I think somewhere along the line, I'm not sure when it happened, there became this little wall in between of like, well, this is what we do to prepare a graduate, and this is what we need in practice, and we've lost that connection.
I just wanted to go back to the comment that Mark made here about the undersecretary and the dog that doesn't bark, if you will. I really do think I've had the opportunity to sit in a number of workshops related to accreditation and to hear individuals who represent the U.S. Department of Education speak. And the truth is that it goes back to what I was confused about a few minutes ago, is that they're really talking about institutional accreditors, that the department's frustration is really with the institutional and national accreditors, and that while it's true there is some frustration with programmatic accreditors who may allow programs to continue to be accredited at institutions that are having difficulty with their institutional accrediting body. I actually asked the question at a session about a year ago where we had representatives from congressional offices speaking to the concerns that the department has with accreditation. And I asked if they understood the difference between institutional and programmatic accreditation, and they said, quite frankly, no. And that really what their focus was on the institutional accreditors. So.
Virginia Adams, the National League for Nursing. I have a different perspective on some of the accreditation piece, and especially with protecting the health of the public. There's a crisis in the country of HBCUs being disavowed of their accreditation. They're losing accreditations and the institutions are closing. The graduates from these institutions are the ones most likely to go into a lot of the marginalized communities actually and help protect the public. So I have some concerns about what that means with accrediting agencies. Those institutions are losing funding, and I think that's a big piece of it. So I don't see the accrediting agencies helping from that perspective in protecting the health of the public.
Thank you. Yes.
I really support that statement. And one of the things that we often don't look at in accreditation is the aspect of barrier to entry into practice means lack of access. If the practitioners are not there, they're not delivering the care. And oftentimes we forget that part of the equation. So I'm really glad you brought that up.
I mean, just I would want to say that, I think Mark's comment about accountability is important. I think the other point that's important is actually having the right standards in the first place, because sometimes the standards are not focused on the point, what are the purpose of these standards? Are they in part to drive, I think this morning Susan actually said, there's some things that the accreditation process is for, and there are some things that it shouldn't be used for, and sometimes we get them muddled up. And I think, revisiting some of the standards to make sure that they really are fit for purpose rather than fit for ambition is important.
Great. So in the interest of time, let's move on to the next question. So the questions just get easier. What is the future of education and accreditation balance across the world?
Let me just start off, because I think one of the things that we do need to think about is that if we actually look at the long-term demographics, we are going to see a significant shift in the population support ratio, which is the number of people that are in employment versus those that are retired, and the complexity of the health and social care needs is increasing. So the way that we use people into the future to deliver any kind of service, not just the health services, is actually going to be very critical. So there is going to be a need to streamline and to ensure that we are not duplicating processes, because we just simply will not have the person hours needed to do repetitive and parallel processes. So I do think there is a realization, and certainly when I, again in my previous job, was speaking to both health and education ministers, there was a recognition that in some countries they're already hitting that barrier. If you look at the United States, both the East and the West Coast will face the problem slightly later than the Midwest corridor, where the demographics is shifting slightly differently. So, I think one of the things is actually about how do we use the very precious human resource that we have as we move forward, because we will need to streamline and some of these systems in a much more efficient and effective way.
Great. Other comments? Eric?
We haven't talked too much about this today, but I also think related to this, it may be more in the quote certification world, if you will, licensing world, is the shifting nature of roles. What people can do now versus what they can do in the future, and we've already seen that happen quite a bit. We've certainly seen the tensions around that. But I think it really relates to your point about with the shifting demographic, it does mean that roles are going to change. And so I think that's another piece that accreditation is going to have to attend to. What a physician does today is not going to be what it does later any more than a nurse practitioner, pharmacist, veterinarian. I mean, you name it. I mean, it's just the nature of what happens, even through scientific advances, let alone the changing demographics. I think that's going to be a really important point, and that's an area where silos and turf can get pretty intense. I mean, we think accreditation's tough. That is an amazingly emotional conversation. What I have to do is look and see what happened in Missouri regarding, if you wash out, you can automatically become a physician assistant out of medical school. So, that kind of stuff is going to continue. And part of it's being driven by, perceived needs. You don't have a primary care workforce is one example. So I think that's going to be important.
Any other comments, other thoughts? You're running out of gas here. Come on.
Mark Merrick from Athletic Training Accreditation. We're starting to have a lot of inquiries internationally from organizations in other countries who are interested in doing the kinds of things that we do, although our profession has a different name in other countries. And we see a lot of different kinds of scenarios that we're looking at. In the United States, we have both a pretty robust education industry as well as a pretty robust regulatory arm for people entering in practice. And it's not always the case internationally, where in some places, if you have the degree in that area you're able to practice. And there's not a regulatory barrier for you to get into. So I think that part of this question is also balancing the regulatory side. But I also, as we talk with our international partners, their needs are not necessarily met by copying our accreditation systems. And that from an accreditory and regulatory standpoint in those countries, you have to really look at the culture and environment of what's needed there and what's needed now. From a maturation standpoint, they may not be ready for the full-blown kind of things that we do, but they need more than they currently have. And helping them find that balance, I think, is going to be a priority.
So Debbie Kochever, Tufts Cummings School of Veterinary Medicine. I'll just PR on page 10, session 3, tomorrow morning, Innovative Models of Accreditation, One Health Accreditation Across Nations. Again, back to sort of the veterinarians. And we, in the international accreditations that have been done there, it is all about context. Someone talked about that earlier. So if you're talking about the US, Canada, and Europe, then the differences you just alluded to might be vanishingly small. As soon as you go to countries that are in a low to middle income situation, then it's not the same conversation, but there's still an enormous amount of value associated with talking about standards, talking about how those standards can be met in a different environment. So, so stay tuned.
I forget what workshop it was, but a couple workshops back, we had somebody talk about polarity thinking or polarity mapping. And I think there's a lot of polarities involved in accreditation, standards versus flexibility, assurance versus improvement. In that, that model, we too often see them as an or when this should be an and how do you manage those polarities? And that might be an opportunity for this community to begin to take a look at some of those in the context of what's going to happen in the future. So I just was reflecting back on that. I think that's a real issue for much of what we do, but I think particularly for this question.
I just want to reinforce the points made by our colleague from veterinary. My own research looked at international comparative analysis of nurse regulatory frameworks, and the dynamics in there that were important were the legal framework that was in operation. So was it a common law system, a civil law system, or an Islamic law system? Because that actually had significant differences. The high income, low income was another piece. Some of the low income countries had absolutely nothing at all, and how they transition from one to the other. Kind of moving back to the point I made to Nelson earlier, they don't need to follow every single step. They should actually jump in at the point that's right for them. And then the third piece is actually some of the cultural dynamics that actually are at play that can be a difference. For example, the role of the registrar is well known and established within common law systems, but within the civil law system, it's the president of the structure, the order, etc. So I think there are some pointers that we need to be conscious of as we start to look at this. It's not a one size fits all, but when you actually look at what they did, there is remarkable commonality. It's the way that they did it that there is difference, and I think I think there are good scope for having that identification of what needs to be done, but you need to tailor how you do it relative to where they are in that continuum of their evolution, and not hold people to a linear stage of development, but to jump in at the point that's right for them.
Thank you. We have less than 10 minutes left before your well-deserved break. Let's go on to the last question. So how do we partner? How do we partner best with patients, populations, communities, in promoting the role of accreditation and ensuring quality education and training? And some of those things were alluded to, I believe, in number 2, the sort of the crowdsourcing of some of these things and getting the public to comment. Other thoughts on this one?
If you've been following federal issues around accreditation for a while now, you know that there's a great deal of tension regarding the historical roots of accreditation and the current desire for an extra-governmental regulatory process. And so I think if we could refocus what accreditation is really meant to do, then that would free up accreditors to do that better and be able to translate that mission to the public in a way that would be meaningful, as opposed to accreditors trying to be used as the guard or the policeman for many different interests.
Thank you. Other thoughts?
So I think there are things that we can learn from parallel processes, and I've been quite taken aback by the fact that the recent Supreme Court judgment in relation to the FTC case against the Dental Board in North Carolina, that people were really surprised about some of those issues, because you could track back the wording that was used in the judgment by the Supreme Court to some work that the OECD did back in the late 90s. And it has repeatedly occurred in terms of recommendations in relation to the wider arena of best regulatory practices. So I think sometimes it's about actually looking at some of these parallel type systems and see what has been identified as potential best practices in there. So there's a whole raft of recommendations around engagement, around involvement of different stakeholder groups that can be utilized. And the thing about OECD is the US is part of that club, and therefore they are actually signatories to some of these processes anyway. But we tend to stick in our narrow box of interest rather than actually looking more widely to related fields. And I would say that part of the benefit of this arena is that we're bringing accreditors together from different perspectives who are listening to one another and hearing what people are doing and going back hopefully and saying, I wonder how that might apply. So I would, in relation to this particular point, suggest that some of the OECD work, which is extensive, which is really extensive, is worth looking at.
Other thoughts, other comments? Yes.
Rosemary Senjum again from the Commission for the Accreditation of Birth Centers. I think just to repeat some of the concepts that have come up in other questions, work with the willing, just start there, and look for common ground has been mentioned a lot. Also, figure out what's in it for each other, not just what's in it for me. And just ourselves to consider how can we be the first to do a new thing instead of a more defensive stance of, oh, I'll do it if you do it, but if you don't do it, I'm not really going to do it, and I wouldn't think of doing it otherwise. But to be more proactive and say, hey, I'll do this. You want to join me? To be willing to be leaders in the partnering effort.
It was mentioned earlier, it might have been Malcolm and others too, but the leadership, there really needs to be the leadership and agreement that moving toward a country of a focus on health, and that everyone is part of this, all of the stakeholders, David, that you mentioned. But it really is going to take all the professionals to make a commitment. I mean, we can all sit here and say this is really good and it will improve the health and outcomes, and everyone will have optimal level of health. But then professionally, everyone goes back to their camp, and the number of, as we mentioned, specialty groups and subspecialties is still growing. And it's totally in conflict with there's going to be more needs and fewer resources. And there has to be a way of a conversation to bring these together so that every decision made by all of us and all the other stakeholders say, well, you know, we all want to have maximum health. How do we all drive what we do through that to make those changes? And then you don't feel like you're giving up anything because you're moving towards something. But it's this leadership piece, and these conversations I think are very helpful in all of us thinking about it from what we bring and then our common goals.
So this is going back to sort of what David said. Has another field done this besides health? Has there been I don't know, an aero and flight, you know, and space and, you know, some other field where there was two sides that had to come together around standards, accreditation, safety? You know, maybe there's another field that's done this and we can learn from that. But we not only learn from that, but it's a good way to sell it to patients, populations, communities, because other people have done this and they've been successful.
Airline.
Yeah, banking. I mean, I don't know. I just think about how you can.
Have you seen The Big Short?
Yeah.
Bank.
You know, you can go right now and, you know, get lodging, flight, and a car all on one website. I mean, I'm just thinking about what does others have done that have put this together. I don't know the answer.
There's a woman called Dr. Rona Flynn, who is an organizational psychologist in Aberdeen, who has been looking at the alignment between educational systems and practice, and she's been looking at high-risk industries. So it's the airline industry, the oil industry, nuclear industry, and believe it or not, surgeons and nurses working in theatres. And these are high risk environments where if you get it wrong, someone dies. So you know, I think that criticality. So there are things there that we can certainly look at that in terms of alignment.
We are out of time. I don't want to cut off this wonderful conversation. We can continue it, but I sincerely appreciate your attention during this time, and all of your comments were wonderful. Please join me in thanking David and Karen for their input as well. And Patricia for taking all the great notes. Thank you. We will reconvene here at 4:30. You have a break. We'll be in this room at 4:30. Thank you.